Hi, my name is Amy, and I'm a physical therapist at Select Physical Therapy. Typical day as a physical therapist is we see about 10 to 15 patients a day. An example of one patient we may see, say someone who had just had knee surgery, they would come in their first day and we would take them in an evaluation room and kind of get what we call the subjective information. We would ask them, the history of any kind of medical condition they have. We would find out how the injury happened that led up to the surgery, and just different questions about that and kind of what their goals are when we are here at physical therapy. Then we would move on to what we call the objective information, and that would be measuring. So we kind of look at their posture and we do some strength testing to see kind of where they're starting as far as their strength. And then range of motion type stuff, meaning just seeing how much they can move that joint compared to the other side, which would be their normal side. And then we kind of wrap things up with giving them education on this is, your precautions, if you have any precautions after surgery, icing it or heating it if they need to do something like that, and just kind of what to expect whenever they're here. So then after that, we schedule appointments with them, and when they come in next time, we do what's considered like the daily routine that they'll have. They'll get on the exercise bike, maybe if it's a knee, and they'll start to warm up and that kind of thing, and we give them some stretches and just any kind of addressing all the things that we found in the evaluation. And then they would, would maybe do some ice and put some what we call electrical stimulation to help with swelling. So we try to cover the whole aspect of things, starting with strengthening and getting that motion back, and then trying to help them out with pain and swelling. The work hours are about, at the outpatient clinic where I'm at, is a 40-hour week, and with some time of having notes and stuff to do, which ends up probably being between 40 and 45 hours a week. And so to be a physical therapist, you have to get, now it's a doctorate of physical therapy degree. First, it's a 3-year program and you do a lot of anatomy, physiology, those kinds of courses, and getting a lot of hands-on manual type skills, and just learning how to stretch patients and that sort of thing. You do a number of clinical education type stuff. You go to the clinic and you learn these things and kind of apply it throughout the program, but the biggest thing is to get the internship at the end, where you get about 3 months of experience in the clinic. And then before you even get into physical therapy school, you have to get your bachelor's degree. Now, you can get that in with any degree, but then you really need to, what would be beneficial to you would be to get a science-based degree. I got a kinesiology degree with an exercise science concentration. So you can use a biology degree is good. And some people go into athletic training. So those are a number of things you can go into. And then when you finish up your bachelor's degree, you have to take the graduate record exam, which is the GRE, and that will help you get everything you need to get together to go to physical therapy school. So the best part about being a physical therapist is really helping others. You get to use the skills and all the things you learn along the way and that you work so hard for to help people and make them better, and then they just love you after. Another thing is just, I really like the hours. I feel like the hours are, you can have a family and that sort of thing. It's lends itself to be able to be kind of flexible, and another good thing is it pays pretty well. So altogether, that's kind of the best parts of the job. And I would say the worst parts of the job are Documentation. You have to document everything that you do every day with each patient, and sometimes it goes past your normal daily hours, and sometimes you get behind, so then that adds a little bit more to it, but mostly just documentation is kind of the biggest downfall. What we say is that if there was no documentation, this would be the perfect job. So if you can get past it, but it's just definitely a challenge. Other things that are kind of worst parts of the job would be with being with patients who are somewhat difficult. You have different personalities and people who don't always listen to your advice, and you just kind of have to let that roll off and keep going with it. So all in to help you get into physical therapy, you need to, it's actually a pretty competitive field to get into the schools, so it's important to keep your grades really high and get involved with as much anatomy and physiology classes in college to kind of get you a head start. If you can get into the physical therapy setting, a lot of times there's either some volunteer work that you can do or a physical therapy tech job in some places, and that will help you just be in the setting and get used to seeing how things are run. And just keep in mind that the GRE is an important aspect of getting in, keep getting that, as preparing for it and getting as high a grade. And all those things combined along with an interview, or a lot of the schools need that for you to get in. So just keep working at it, and good luck to you.